My name is Earl Gray. I am here for a few reasons. Number one, I'm an EMDR psychotherapist. I use EMDR as my primary form of treatment. I'm also here presenting this poster, the first research ever on the efficacy of tactile stimulation using EMDR. I'm also doing a presentation on Saturday about the neurophysiology of the brain and how it is connected to the adaptive information processing model supporting the EMDR intervention. I became a believer when I started reading everything prior to my training, because I saw the changes in people using the multisensory techniques. The difference is EMDR has, in my opinion, a greater impact in a more rapid way, where it might take years and years and years and years and years for someone with significant issues to recover using traditional psychotherapies. EMDR can decrease that significantly. Who doesn't want to feel better faster? Change is difficult regardless of what we're changing. Change is not easy. If it were, we'd all do it. So this helps, number one, helps the change process move more fluidly. And number two, it also gives the individual that internal sense of confidence, progress, and self-esteem that we need to be able to change when you use the different interventions and techniques involved. So that's what makes it a little more rapid than other psychotherapies. And I'll be honest with you, I actually tell my clients, at some point through the therapy, you're going to have an aha moment. I don't know when it's going to happen. I don't know how it's going to happen, but it's going to happen, and you'll feel the difference. And so we just go through the process, and we take the journey. And when it happens, it happens. It's so amazing to see the difference. It's a shift in the person's identity, how they live in the world. It's just an amazing thing. I am surprised and excited every time that it happens. The human being is a powerful being, and when we give it the respect that it's due, it can really do wonders. It impacts the brain physiology, is what it's doing. We are working with the brain, okay? So the brain's wired a certain way based off of our biology and our experiences throughout our lifetime. We know this. What EMDR is doing is taking the stuff that we learned and how we learned it and reorganizing it in a more meaningful and effective way, or adaptive way. We all have our own issues. Everyone has bags. We all live a certain way and things happen. How we process and store that information in the brain is unique to our experiences and our genetics. What we do with EMDR is we help someone take this, reorganize it, and put it in a different place in their brain, so they can think about it differently in a conscious way instead of in a habitual or compulsive way. And that's the difference that we're really seeing. That's what makes people change their eating habits and change their behavior and change what they're doing in their lives.
Yeah.
Absolutely. I think it's important that everyone has access to the best and the highest quality treatment. It's actually the mission of my private practice is I will give you the highest quality therapy I can give you for whatever you can afford. It's so important that people get what they need where they are without having a lot of stress. People are coming to us because they're having issues. Adding a financial burden, adding a travel burden, these are all things that can impact the outcome of treatment. So we as clinicians really have to be evaluating what's best for the client. And sometimes, in my opinion, that means accepting a lesser fee, or sometimes doing free services. Because if you're in this business to help people, you're in this business to help people. The rest will come if you do it in that respect.